Calcium ion homeostasis. Why do we need calcium? It's going to help with our bones, our teeth, it helps with blood clotting, nerve impulses, and most importantly, muscle contractions, which are needed for the heart. So, when you have a stimulus and the blood calcium decreases below the normal range, it creates a feedback loop. So in the stimulus, when it decreases below the normal range, it's going to go to the receptor where you're going to meet the thyroid. And once you find thyroid, on the posterior end of the thyroid are these little parathyroid glands. The parathyroid glands are going to detect this low blood calcium level. And it's going to go down here to the control center. The control center is going to release, the parathyroid gland is going to release the PTH, or parathyroid hormone, and it's going to release it into the bloodstream. So the parathyroid gland releases PTH into the blood. PTH and vitamin D will make their way into the bloodstream, and PTH and vitamin D will send a message, which is going to go over here to the effector or response. So that's going to lead to these little cells called osteoclasts, and they are going to reabsorb calcium from the bone. So they're going to take the calcium from the bone as well as put calcium back into the bloodstream. From there we go down to the intestines, where they're going to absorb calcium. And then we go to the kidneys, which are going to retain calcium. So they're going to reabsorb and keep the calcium and basically tell you not to pee it out. So once all of this has happened, we're going to go back into homeostatic range. As blood calcium ion returns to normal feedback, stop effector responses. So it's going to be in the normal range for the feedback. So a negative feedback decreases parathyroid gland cell secretion of PTH. So that is our negative feedback loop, and that is calcium ion homeostasis.